Dr. Troutman, would you like to go next?
Why, sure. This particular part of the agenda is I'm going to be very personal about it because that's what it says. I've been engaged in this work of social justice in one way or another since I was a teenager, since about 18, 19 in college, and it's been like rolling over from one discipline into another, but carrying the same work. So I started as a teacher in a good community college, and I got a master's degree in Black Studies, and then went to medical school. And throughout that, it's been a connection of how did we get to a place where so many people die sooner than they should, are sicker than they should, don't have access to the basic necessities of life, are facing racism, discrimination, murder, lynching, you name it. It's been a part of the existence. And how do you finally do something about that? For me, it was medical school and school of public health. We were talking to my colleagues last night about some key branch points in my life. One of which was the birth of my first child. This was during the time when I didn't trust anybody who wasn't Black, frankly. I had been through history and news reports and seen things I just didn't feel comfortable about, and my child was going to be born, and my wife had to have a C-section, so I had to leave, and I had to leave my family in the hands of people I didn't trust. And I said, that's not the way it should be. You ought to be able to trust the people who are taking care of you, and that was my at that moment in my life was the moment I decided to go to medical school. Since then, my work has always been around social justice, human rights, and right to health, in finding ways to eliminate inequities, beginning to understand the connection between social determinants and health status, and how to apply that across the board to improve the health of all people. But my primary focus has always been the African American community. So this is an extension for me of lifelong's work. Emmett Till, many don't know the name. Emmett Till was a young man from Detroit who went down south and was murdered by a gang of white men because he supposedly winked at a white woman. And he was at an age that I related to me in my age when I was a kid, and seeing his coffin, which was open, by the way, so that they could make a point, just did a lot to me on the inside. As this could happen in the country I live in, a kid goes down in South and he gets murdered and just totally disfigured because he quote unquote winked or whistled at a white woman. So there's a lot wrong with this country, and a part of what's wrong with this country is the continuation of health inequities. The fact that if you're an African American in this community, the work with David Satcher and I did a few years ago, 84,000 Black folk, African Americans, die in excess every year. And if you add Latinos, Native Americans, Pacific Islanders, Asian Americans, and others, we don't even know how many people. We don't even know how many people. We don't know what the number is. It could be 200,000 people a year dying in excess, and that means that the system. I started to say the system sucks, but I'll say it: the system sucks. And we have a responsibility to tie all these things together and assure that on birth, people have the access to the right to health and live lives the way they should without having to worry about all the terrible things that happen to them. So that's my personal statement.